Welcome to the New Dentist Study Club podcast. My name is Dr. Sanj Mohanta. We're going to learn about clinical management, practice management, and the emotional management of dentistry. Let's learn how to be happier in dentistry. Let's go. Hello, my friends. Thank you so much for joining me again on another special episode. This one is with my good friend, Dr. Zoha Anjum, who just graduated last year. So she is going to teach us everything she's learned in that first year. And by the end of this episode, you're going to learn, if you're a new grad, things you should be doing during your first year of practice. And if you're a new practice owner, because Zoha is a practice owner, you're going to learn about the business of dentistry as well. So Zoha, welcome to the pod.
Thank you. What an honor to be here, first of all.
Oh, I'm honored to be here with you because I was friends with you like right from the beginning of
Yeah.
your dental school career. We became friends, and now I'm so proud of you. You're a dentist now, practice owner now, podcast guest now. So
I think that's the most important
yes,
out of all.
exactly. It's true. So Zoha, tell us about yourself.
Well, like you mentioned, I'm Zoha and I graduated June 7th, 2024. Feels like many, many years ago, but it's 1 year, which felt like eternity. Before dental school, I did my master's in public health. So my interest in dentistry is a lot more from public health side and prevention and oral health education. And so that's a little bit about me from the academic side. On a personal note, again, now I've been working, trying to find hobbies again now that I'm not in school anymore. I can be a normal person. So I've been enjoying hiking a lot. I moved to Milton last year. That's where the office is. So I've been exploring the trails in the Halton area. And then recently got married as well. So trying to adjust into the newlywed life. So to conclude, there's been a lot happening.
Yeah.
Like a season finale, but I'm hoping now that the wedding is done, I can just settle down and be at peace with work and have a work-life balance, which I know can be a struggle, but that's what I'm hoping for in the next couple of years.
That's why I thought you'd be a perfect guest on the podcast because within the last 12 months, you graduated, you moved, you're a practice owner, you got married. Like it's basically like a decade's worth of milestones all in 1 year.
Yeah.
So let's go to the first week as a new dentist. What was that like? What do you wish you knew?
That's a very loaded question because there's the answer as a new associate, and then there is
Yes.
the part which speaks to being thrown in the arena where there's no one to tell you what to do. So a little bit of context, how I ended up becoming a practice owner is my dad got sick. He recently had purchased a practice. He got sick. And then I was kind of thrown into the field to kind of juggle it all up and get things up and moving. And then on my first day of work, I remember that I did not have a receptionist. I had an assistant who was also not fully trained. They were going through training with my dad before he got sick. And my mom, she came with me. That was the only day she came to the office when my dad was sick. So she said, it's a big day. It's the first day of work. Let's go. And I just remember sitting there thinking, what the hell am I doing with my life?
Oh.
Then, because I didn't have a receptionist, I'm thinking, billing, what? Because in school, they took care of all of that. And I remember sitting down at the end of the day when I have a list of all these people I saw and the codes, and I'm thinking, okay, now I need to learn the software and do the billing because the billing has to be done the same day.
Yes.
And I think I was there until 8 p.m. My mom and I are trying to figure out what to do. And then eventually we did figure out what we were doing. But I remember the first patient I saw was a recall patient, and I was questioning myself so much, thinking, yes, it's just a hygiene appointment, but there was just so much pressure to perform. And when I think about it now, that pressure was not from my mom, not from my dad, not from like a supervisor or an instructor. That pressure was coming from me.
Mm.
And holding myself to high standards and saying, this is my first day as a dentist. It's my first day in this practice, trying to lead this team that I have. I need to be the best at it. But over time, as I realized how burned out I was getting because I was so attached to that perfect person, ideal dentist associate, that I thought, you know what, this is not sustainable for me. I need to let it go. And it took me 3 months to eventually hire a receptionist because I thought, you know what, it's not an expense, it's an investment. And it showed that it was an investment because, my receptionist, she was calling patients, booking them in, and making sure payments were coming in. So, anyways, someone told me people learn all this in a 1 year MBA course, and I said I learned that there was no grading. The failure was that you're going to be kicked out of where you are.
That's incredible. I really like the fact that you were talking about the perfectionism because that is something that kind of goes hand in hand with dentists, is that they're perfectionists. They lose sleep over an overhang margin.
Yeah,
And meanwhile, the patient doesn't care. Meanwhile, it could be fixed, but we think it's the end of the world.
yeah.
But I'm impressed that you let that go within 3 months because it takes most dentists years to let that go.
It's almost like I didn't have a choice. It was like
Yeah,
I need to find that passion again that
yeah.
led me to this career. I don't want
Mhm.
to hate the profession. I don't want to hate
Yes,
myself for choosing to be in it. And
yes.
that was a decision I had to make, that, okay, this is where I wanted to be. I went back and I read my personal statements and I said, this is where
Wow.
to be. And I worked so hard for, accumulated so much student debt for this, and now I'm here. And yes, things didn't turn out the way I wanted them to, but
Mhm.
this is what I have to do. Like, I have no choice.
Yes, that is good. I'm impressed with the personal growth that you have have encountered over this year. But also, you mentioned really like two great things about what you learned that first week is you have to know the billing and the insurance.
Yeah.
And so for new grads, like take the time to like create a cheat sheet of all your common codes, learn about, the ask your front desk. Like every time you have some free time, just talk to your front desk about insurance, what's covered, what's not, how you should be talking to your patients about treatment plans with the insurance, watch them, how they do it, because it's so important because we didn't learn about the business side at all. It was all clinical.
Yeah. Yeah. I think the last thing you want is get into trouble because you did treatment that the patient didn't want to pay for, and then they're
Yes.
upset you didn't communicate that with me, that I would
Mhm.
pay out of pocket. Again, speaking from experience.
Yes, that's true. Yeah, so a good tip is like for associates, like go in early, like half an hour, even an hour early, so you can go through the charts. You already can like set up some codes that you might want to put in. You've already read their medical history, looked at the x-rays, write a sheet that you and your assistant could look at so you know what you're going to do and have that conversation with the admin team about things like, hey, I'm doing like 5 class 5 restorations here. Am I going to go over this patient's like insurance?
Yeah.
And then, so that way you can have that discussion with the patient before you do all those restorations.
Yes. That's a very good tip that no one told
Yeah.
me in dental school.
Right. And then how about clinically? Like how did you figure out like which cases to take on? Like I remember when I was a new grad, I was just trying everything.
Yeah,
And
me.
then of course I was failing a lot too. So
Yeah.
so what did you do?
So when I started, there was a lot of recalls, hygiene, because these patients hadn't been seen in a long time. And I noticed earlier on I was way too conservative with my treatment planning, where I was thinking, oh, let me put this on observe, let me put this on observe. And I realized pretty quickly that it was almost like I wasn't doing what was right for the patient because I was hesitant to do the treatment. And for example, if there's a big restoration, the patient needs a crown, I recommend a crown, and the patient says, "Why do I need a crown?" And in my head, I'm thinking, "Yeah, you're right. Why do you need a crown?" And questioning myself and, why did I recommend that in the first place? And going, and then the patient's just looking at me, and I'm thinking, yeah, what do I tell them? So then I thought, okay, you know what? I need to go back and I need to like refresh my notes and see, okay, what are the indications for a crown that's, that I communicate in terminology and language that the patient understands. And then I said, okay, you know what? I'm sorting out the communication piece. And then initially I thought, okay, you know what? Like I'm the only person here. I have to do everything. Patient needs dentures, any crown, bridge, whatever. They would need a root canal. I never did endo retreats in dental school, and that's something we were taught to just refer. So that's
Mhm.
what I did. Extractions, we did so many in oral surgery. So I thought, you know what? Let me just doing it. So I would say the first 3 months, I was like doing everything. And then I had a case which did not go so well. And it was a wisdom tooth. It was a 3A. It was grossly fractured. And I was like, I can see the furcation. I can go and start wedging there, and maybe, I'll be able to get it out. And I remember that was my last patient of the day. And the patient was there for 2 hours. The freezing had started to come off. And I'm thinking, like, how am I going to get this tooth out? And then I said, you know what? That's it. The patient's got to go to an oral surgeon because
Mhm.
I can't, because I kept breaking the tooth. After that, I noticed my confidence went down a lot. I became a lot more like, I wasn't trying as many different procedures. I just stuck to, recalls, hygiene, restorative, no crowns, no dentures, no endos. I was like, I don't know if I can do it. Like, even mobility 3, I was like, I don't know. Like, what if it needs a lot and I can't,
Yeah.
you know? So, and then it took me a lot of talking with my classmates who graduated with me and colleagues, and they said, like, you cannot continue to practice and stay sane if you think you're going to get everything right. And it goes back to that perfectionism
Yes.
piece, right? Even people who've been in the field for many, many years, you still encounter something that will have you, question if you even know what you're doing. And that's something I learned from Neki, actually. I attended his extraction
Yes.
course, and he said, I have extracted so many teeth, but to this day, there are some cases where I struggle, and that's okay. That just means you are continuing to learn something from your profession every day.
Yeah, that's a very good point. And the best thing that comes with experience is knowing which cases to take on and which ones not to. Like I'm at the point where in the first 5 minutes I can tell, is this a patient that I'm going to be able to work with? And like right away I can take a look at, full mouth series and know like which things I should do and which ones I should refer.
I think
And
another,
but that takes experience.
yeah,
Unfortunately, like you're gonna make a lot of mistakes at the beginning taking on wrong cases.
yeah. I think another thing that helped me is having a network of people who I can run things by quickly. So,
Hmm.
if there's medical, for example, I had a child with like facial swelling, and like my first thought was, oh, maybe antibiotics are indicated, but then
Hmm.
that the kid has ulcerative colitis, and I thought, okay, maybe not. So,
Hmm.
checking with the group, hey, what do you think? And the advice I got, just refer to pediatric dentist. Like, don't do it. So having those
Yeah.
people who can kind of, remind you if there's anything you're forgetting, or tell you, hey, based on our conversations, maybe this is something you may not want to do at this stage of your career. Doesn't mean you should never do it, but at this time, maybe it's too complex for you to be taking on. And other times they're like, Soha, it's so straightforward, just do it. I think that has been a lot helpful, especially after that poor experience with a case.
Hmm.
So devastated. Oh my God, like I just don't want to do anything. Like I can't get it right. Like all of that, the conversation we have in our mind, or we're questioning ourselves. But having the right kind of people who can tell you, no, you were trained for this. You
Yeah.
know your stuff, like you know how to do it. So that was really helpful too, like having.
Yeah, it's very important to have a network and reach out to your specialist, reach
Yes.
out to your peers like you did, even other staff members, even your assistants, the other hygienist will take a look at the x-ray or take a look at the patient and say like that patient's not going to cooperate with you, like refer. And the other thing is like when you if you do have mentors, like right in the office, oftentimes we think, oh, we should ask them, how to section this tooth. But instead, we should go back to the very beginning and just show them, your diagnostics and say, should I even take this case on?
Yeah.
And they will point things out to you as to why you should or shouldn't.
Yeah.
And in order to build your confidence, you have to start at those really simple things and work up to the hardest.
Yeah.
Because
I mean, the
otherwise,
thing
you're
is,
doing a 3/8, like a badly decayed 3/8 extraction within your first few months. Any new grad would have failed at that.
yeah, no, I think it's like it takes time to learn like where are my bounds, right? What can
Yes.
what I can't do. And I think first year is all about that. You just learn
Yes.
this is where my strengths are, this is what I
Mhm.
need to improve on, and then you just take CE courses based on things that
Yes.
either want to avoid completely, like stuff you're weak at, you're like,
Yeah.
I don't want to do this at all. So you just take CE and what you're good at and get even
Yes.
better.
I
Or you
know.
say,
Yeah.
you know
Yeah.
what, I want to get better at what I'm not that good at. And then you take CE courses, it helps you decide.
And just keep ramping yourself up. Okay, next time I'm going to do a little bit harder. Next time I'm going to do a little bit harder. And if you are doing those more challenging cases, always do it when there is someone else in the office who can back you up, or you've already reviewed the case with someone, so you know all the steps involved, and then you can refer to that person if things don't work out. So yeah, there's a strategy involved, but it is completely normal. I did the same thing when I was a new grad, just tried everything because you don't know your skill level because you
Mhm.
had so little training in school, and also you're not that great in even assessing which patients, like their
Yeah.
personalities, their temperament, their anxiety levels. So you're learning that as well, which like patient selection, not just case selection.
Yes. I think that's more important. Patient
Yeah, it's true.
selection.
Yeah, so I was going to say because patient selection is really important as a new grad because some patients don't trust new grads. They will ask questions like, how old are you? How long have you been doing this? Are you a student? So have you had those conversations with patients and how did you respond to
All
them?
the time.
Okay.
Um, I had, well, people always ask me if I'm shadowing or if I'm the dentist. So I got like a nameplate that I put on top of my gown that says Dr. Zoha Anjum. So we're
Okay.
clear on that. Um, Another thing I've noticed is it's happened a couple of times where I would come into the room and I would say, "Hello, my name is Dr. Zoha Anjum. I'll be your dentist for today." And then patients would say, "Oh, hi Zoha, how are you?" And I noticed that I checked with my colleagues in the same office and they
Mhm.
said, "Oh," and I said, "Do they jump to your first name right away?" And they said, "No, they don't. They call us doctor, whatever." And initially, I thought maybe I'm just overthinking this. And then I looked into the literature, and apparently, that's a thing. Like, if you're a young woman of color, like in medical healthcare settings, you're
Yeah.
likely going to be referred to as your first name rather than
Yes.
doctor last name.
Yes.
Um, Anyways, but I had another patient actually ask me if I'm married, and this is last year, and I said,
Yeah.
um, no, I'm not. And then she said, yeah, you know what I was thinking? I looked for a ring and I thought I was trying to guess your age. And I thought if she has a ring, that means she just looks young for her age. If she doesn't have a ring, then she's too young to be here. And I'm thinking, oh my gosh, like, okay. So what brings you here today?
That happened to me a lot too because I got married in dental school. So thank
Yeah.
goodness I had a ring because I looked really young.
Yeah.
And people would always look at the ring and go, "Oh, thank God you're married. That means you're old enough to work on me."
So I think it's a struggle, and I feel that a lot of times it's easy to get caught up in the fact that, oh, I need to convince the patient that I know my stuff. But I think when you have that confidence that I know my stuff and you educate your patient and you're confident in what you're saying, you don't have to convince them hard because they can see the education, the skills, the expertise
Yes.
that you have. So initially, I did find myself getting caught up in the, oh my God, I have to impress this patient. So, they'll accept my treatment plan that I'm making. Even now, there are some days where I feel like I'm trying too hard to prove my level of education and expertise. But then I tell myself later, hey, it's only been a year, it's fine. It's
Yeah.
okay if sometimes you get, lost in that world. Oh my God, I need to really show them that I know what I'm doing. And then anxiety about, okay, you know what, I haven't done a crown in a really long time. What if I mess up? This patient's gonna drive me crazy. So there's that fear too, which is, I don't know if ever goes away, but it does affect you psychologically where,
Hmm.
from the get-go, patient doesn't trust you because you're too young for your age. Two, they know you're a new grad.
Hmm.
You up on the RCDSO website, and then three, you're doing a little bit of complex treatment for them, and then it affects your performance sometimes.
Yeah, it's true.
So I think having the confidence as much as you can helps you show up and say, hey, I went to school for 4 years.
Yeah.
I've done these cases before. I'm going to do what's scientifically and accurate and evidence-based, patient-focused. And if something does go wrong, these are the things that can happen. If you're okay to proceed, we proceed. If any of these are concerning and you'd like to see a specialist, I'll happily refer you to a specialist.
That's excellent. That's good.
And you
You're
let
giving
them,
them the choice. Yeah,
yeah,
you're giving them the choice.
yeah,
And like you said, if you're confident, they're confident, and give them the choice. And if that patient would rather see a more experienced dentist in the office, don't be insulted.
yeah.
It's let them go, because if anything went wrong, they are not going to be on your side because they've already, they were lacking trust with you in the beginning.
Yeah, yeah. We need to be able to sleep at night.
Yeah, it's true. Exactly. Now, how about practice ownership? Like like you didn't learn any business skills in dental school. So how did we learn even like about hiring the receptionist, about bookkeeping, about payroll? How did you figure all that out?
Honestly, last year has been such a blur in my mind. A lot of it is again my network, people that I was shadowing, for example. I went to shadow one of my mentors one day. This is before I got my license, and she said, "Come in, and It was an administrative day for her, and she said, "I'll show you everything that I take care of that you have to as a principal dentist in a practice." And she told me, "Do you know how to run the sterilizer?" And I was like, "I have no idea how to do that. What are you talking about?" She's like, "You need to know how to run a sterilizer. So if your assistant or if your floater, whoever is doing it, is sick or away, you know how to do it. And you can train them and make sure it's done properly because it's one of those things you don't want to mess around with." So I learned how to do sterilization that day. And then I came back to the office and I was like, okay, they had sign, dirty, clean, they had partition. I need to replicate that. And then one day I was talking to someone and they said they were in the process of buying an office and they said, I have to think about if I want like what thickness of lead sheets I want in the wall. I was like, wait, that's a thing? So they said, yeah, you're supposed to have like lead in the wall so the radiation is not going across rooms. And I said,
Yeah.
okay, what's the difference between different sheets? They said, okay, if you're going to have regular x-ray, this is the thickness. If you're going to have a CBCT in the future, you need double of that. I was like, oh my God, that's so weird. So is there any regulations about that? And that opened up the whole like radiation business with the Ministry of
Ah,
Radiation.
yes.
So a lot of it was just like people were just dropping things at me. Did you figure this out? Like, oh my God, this is a thing. And then the annual like HARP inspections and all.
Yes.
Oh my God. All of it, most of the things were like people reaching out. Hey, last year we were here doing this inspection, your oxygen cylinder, your due. Like, oh my God, I forgot we had an oxygen cylinder.
Wow, you're just learning on the fly.
It was crazy. It was, oh my gosh.
But do you have any tips now that you've been a practice owner for a year? Like if someone's starting a new practice, what would you say they should do to learn the business side of dentistry?
I think the best thing is to learn from the places where you're associating. Like when you're working at a
Mm,
place in a long time and you're seeing, oh, there were these people here, they were testing the x-rays, and then a lot of times they'll put stickers on your x-ray to see that they were
mm,
tested. So be curious, like ask questions. What system is being used at the office? When you use that system, you learn, okay, I hate it, or I love it, or I'm like indifferent.
yeah.
So knowing
Mhm,
how the system works, I think one of the important things to learn from the receptionist and office manager point of view is how are the patients retained in the office? Because I've noticed in a lot of like the courses that I attended on like business side of dentistry, they were focused on acquiring new patients, but we need to have like
mhm,
metrics on how our patients experiences at your office. Are they coming back for their hygiene appointment? Are they leaving
mhm,
happy? Are they referring? Like all of those numbers, they show the health of your practice. And I think, unfortunately, there's no boot camp to teach you how to run um, a dental office. And
mhm,
I think the best thing is to learn from people who are already in the field. The other like little tip that I have is if there's any machine in your office, chances are it has to be inspected at some point. So
yes.
every compressor, sterilizer, like whether it's a Panorex, CBCT, whatever you have, just check with the manufacturer, if there's and like how regularly you need to replace things, how regularly you need to get them inspected to make sure they're running optimally. Anything that has to do with health of the patient, like sterilization, you got to keep logs of that because the Ministry of Health can pop in any day. Same with radiation, you got to make sure your things are running properly. I think a lot of it is something that the dentists themselves don't really have to stay um, you
Mm,
know, up to mark with. An office manager can take care of that, but because for me, it was like, I need to learn everything in this office and how it works. So I can make sure one, it's done, and two,
mm.
when I do hire someone, they can do it the way I want it done because I learned it the right way.
Yeah, that is so important, Soha, that you should know how to work every single piece of machine in the office. You should be able to know how to do everyone's
Yeah,
job, like how to bill patients,
yeah,
send things to insurance. You need to know it all because how are you going to train your staff?
yeah. And I
And
think the
then,
staff turnover too, like you need to find, like that's the whole different thing, like finding the right kind of people. One advice that one of my mentors gave me is that you can train anyone to hold a suction, you can train anyone to
mm,
hand you over the edge and the bond, but you need to find someone that you can get along with, especially when you're working with them for 8 hours at length. People who have good communication, they can make your patient feel comfortable in the chair even before you walk in the room.
yes.
So people skills, very important. And I think sometimes it takes time to find the right kind of people that you get along with. Um, but it's very important because people that you work with can make your life easier or a lot harder than it needs to be.
No, it's true. And you need compassionate people and people who work well with the other members of the team. And if you don't get along with your assistant, it's like being in a divorce. It's like being with a divorce partner all day long. It is
Yeah.
so stressful. The patients can feel it as well.
Yes.
And
Patients know they're in between.
that's right. Well, you guys are glaring at each other under your mask. They can feel it. They can see
Yes.
it. And
Yeah.
then and it's so right about asking your principal dentist like tips on the practice management side, because, I heard from, a principal dentist who owns multiple practices. He has like 15 associates, and he said, not one of them has ever asked me about the practice management side. They always ask me clinical questions. So yeah, don't be afraid to ask your principal dentist business questions too.
Yeah.
And also you were talking about the numbers. The numbers are really important. So, don't be afraid to ask questions to your principal, like, hey, can I get reports on my open chair time, my production per hour, my treatment planning, like what percentage of those patients actually book appointments? So that way you have numbers and goals to work on.
Yeah, and I think
Mhm.
from the practice owner point of view, not just, how much you're making, you also want to know, given this is something that I learned from actually a rep, that you need to know if you're charging the appropriate fee for services, if your fee guide is up to date in your system. And for a lot of people who, if you're, doesn't matter if you're buying a practice, existing practice, or new office, chances are your people do get a portion of it financed. And for banks too, they want to see numbers at the, a specific
Mhm.
point to see how you're doing, if you're making, growing, making progress. So if you're in the habit of tracking your numbers, seeing, okay, how many patients per week, per month are we getting in?
Mhm.
How many patients are missing their hygiene appointments? How many patients are, payments haven't been cleared? What's your accounts receivables? If you have those numbers, you can write up a report, which I did recently do, make some charts and say, okay, this is how the practice is doing. So when you go and you talk to, your accountant, or if you're going to talk to your bank advisor and they're asking you, okay, how are things going? You can actually show up with data and tell them, hey,
Yes.
this is what's been happening. This is how many payments are pending. This is how much we're growing. And that helps you make decisions that are best for you and for your practice, because we know not all practices are successful. Not, a lot of practices, they don't grow past a point, but having that data helps you make conclusions that are based in evidence, and also decide what you need to do, more marketing or change your staff, what
Mhm.
maybe. Now your decisions are rooted in evidence rather than, oh my God, I haven't been seeing any new patients in the office lately.
Yeah. I know that a lot of people are like feeling cringe right now that we're talking about like KPIs, like key performance indicators, but in the business of dentistry and not like how to split a route. But the business of dentistry is really important because if our dental practices aren't profitable, we can't see patients. We can't get the best technology. We can't, pay our staff more. So it's actually best for the patients if the office is profitable because they're going to benefit from that profit.
Yeah. I think I also like shied away from this
Mhm.
conversation before,
Mhm.
but there was one thing that I remember my dad told me like a long time ago. He said, you need to create an environment where if you have people who are working with you, like under your leadership, you need to make sure they're paid, and you create an environment for them
Mhm.
where they can thrive. So if you look at it from the perspective of, I have a team of people who are literally depending on me for their
Yes.
livelihood, I don't just owe it to myself to make sure this, office is a success from it,
Mhm.
by keeping it ethical at the same time, but
Yes.
I'm also able to support these people who have joined me on this journey of, supporting my vision, whatever that may be for the practice. So I think when I thought about it from this perspective, I started to get a little bit less cringe from
Yes.
thinking about money, because, I gotta
Yeah.
make sure all the inspections are done, and they
Mhm.
charge a lot. Need to make sure I'm buying the best products that are out there
Yes.
for what I'm doing. If
Mhm.
anything breaks down, I want to have like spare cash to fix it, and I want to
Yes.
make sure my staff are happy, because if they're happy, patients are happy, I'm happy.
Yes.
You know?
Yeah, it's true. So that was a crash course in what to do during your first year, not only as a dentist, but a practice owner. So you
Yeah.
gave a lot of really good tips, Zoha. So do you have any useful resources that you'd like to share, like any courses that were really good during your first year that you'd recommend to other new dentists?
Yes. I think for me, because I was in this unique situation, sometimes I do feel that I wasn't able to build my clinical skills as much as I would have if I wasn't, as working as a practice owner at the same time. But then I like to think of it, I always enjoyed being in leadership position. This is just like a very unique situation where I just learned everything on the spot. For leadership For dental management, I recommend there are a few, I think there's clinical dentistry. There's a newsletter that actually Peter Barry told me about. I can't remember the name, but he said, they send out mailing lists every now and then, just read their articles. And you don't have to have like, you don't have to have the perfect, recipe on how to make a practice successful. But if you can pick up one thing and implement and that makes a difference, it's worth it. Other thing is, I remember in September, I attended like a dental management course that was run, I can't remember when in September, but that's where I met two of my now best friends actually, because all of us were new practice owners, lost, figuring out what to do. So any courses that you can find, and I would say any marketing course, basically, because they teach you the business side of thing, marketing, and it doesn't have to be dentistry specific. And in terms of clinical, I thought, okay, I'm going to take an endo course, I'm going to take an extraction course, I'm going to do this, this, and this. But then I thought, okay, what's my patient pool? Am I seeing a lot of patients who need endos? No. Is it worth investing time and energy and
Mhm.
resources? Because I'm going to want to buy those supplies that I'm learning to use at those courses. So then I
Mhm.
didn't take an endo course. And then I thought, okay, extractions, I do want to learn extractions, how to do them more predictably. And I registered for Necky's course, like even before I graduated. So I was like, I need to learn from him. But I think at the end of the day, like any course that you take, I always sit down, any webinar, any course, any workshop, I just think I need to just take away at least one thing that I
Yes.
apply to my practice. For ODA courses too, like if you're still in school, you could go for free. If you just graduated, definitely go and tell yourself by the end of this workshop, I want to have at least one thing, one clinical tip that I can apply that I know will help me be a better clinician.
Very good. That's excellent. No, it's true. If you don't write it down, you're going to forget it.
Yes. And it
And
doesn't
if you,
have to be everything, just one thing. You just have to
yeah, it's
know one,
true.
one thing.
And you have to go into the course with that intention that you're going to learn one thing.
Yeah.
Otherwise, at the end, you're going to go, "Oh my gosh, that was such an entertaining speaker," and that's all you're going to get out of it is entertainment.
Yeah, yeah. And that's again, that's one thing that I learned from my dad too. I remember I
Mhm.
was in, I think, third year and I was making a night guard for one of my patients.
Mhm.
It was I was taking alginate impressions and I remember taking 7 impressions for that patient
Wow.
in one appointment because I kept like it was either coming out distorted, the tray is too big, the tray is too small. And I was just so frustrated. At the end, the instructor came and he said, "Let me help you." So he took the seventh impression, and I was like, I was traumatized. Like I went home and I cried. I was like, I subjected a
Oh,
poor human being to so much work.
wow.
Poor man was like alginate everywhere.
Oh,
But one thing that I went home and I was crying. I called my dad and I said, I like it's so dumb. I'm just making a night card. I just couldn't get the impressions. And he's like, do you know there's not much you need to check when you're starting. Like you just need to organize it in your head. It's not rocket science. So every time I do something, I just remember him saying like in my head, it's like it's not rocket science. And afterwards, since then, I haven't had to retake a single impression because I went on YouTube and I was like, I need to know everything about alginate impressions.
good.
What temperature water, you gotta flip
Yeah.
it first. Just because it says three, like, 3 waters doesn't mean it has
Yeah.
three. You check for the consistency. You
Yeah.
check the tray first. You don't just load it up. You're like, yeah, this should fit, and just stick it in the patient's mouth, how to position the patient. But it's
Yes.
like for all of these procedures, like little things that if you remember to do them, they stay
Yeah,
with you.
it's true. It's
But poor,
true. Love that part. You learn from it, and that's the main thing.
yeah, yeah.
And that you mentioned Peter Barry. I know that he recommended dental economics. Like that's a
Yes, that's
newsletter.
what it
So
was.
I think
Yeah.
that's what dental. And then there are two podcasts that I love listening to about practice management. One is called The Dental CEO with Dr. Scott Leon, and the
Mhm.
other one is the Dentalpreneur podcast with Dr. Mark Costas.
Hmm.
So those are both great practice management web
Perfect.
podcasts. Plus this one, the one with Dr.
Yeah.
Zoha Anjum. So, so Zoha, thank you so much for being a great guest. So how can the audience reach you?
Well, they can find me on Instagram. It's Dr. Zoha Anjum. They can message me on Instagram or they can email me at drzohaanjum@gmail.com.
Well, thank you, Zoha. I know you have patient to go to right now.
Yeah,
So I
it's
hope you
8
don't
p.m. on
I
a
don't
Thursday night.
I hope you don't have to do any alternate impressions.
I hope so. I think it's a new patient.
Okay, good.
Today is also my 1 month anniversary. So I'm also annoyed that I'm here until 9 p.m. But it's okay.
Oh, that's what you have to do as a practice owner.
Exactly. I'm hoping there's something nice to go home to.
There will be. I'm sure your husband will treat you. Well, happy 1 year anniversary as a
One
dentist.
month.
1 year as a dentist, but happy
Yes.
1 month a as a wife. So two
Yeah.
anniversaries to celebrate tonight. one
Yeah.
year and 1 month. So congratulations, Zoha, on successfully getting through your first year as a dentist. I'm so proud of you. Can't wait to see, your success in the many years to come. So thank you, Zoha, and thanks to the audience for listening.
Thank you.
Thank you for listening to the New Dentist Study Club podcast. Listen to us on Spotify, watch us on YouTube, share and subscribe, and follow us on Instagram at New Dentist Study Club.